In summer, getting a cold is quite common. Even in hot weather, you might see it in air conditioning and suddenly feel a scratchy throat. Some people quickly develop a fever, feeling very tired, or get sore throat. Within a couple of days, a runny nose and cough often follow. For children, it can be a bit tougher. They might also get small mouth sores or a rash on their hands and feet. These are classical signs of enterovirus. People catch enterovirus through respiratory droplets and close contact and fecal oral route, contaminated recreational water. The disease usually is mild in most cases, but usually it starts with fever, sore throat, malaise and headache, then continues with a runny nose and congestion, plus cough, diarrhea and nausea. Sometimes wheezing and difficulty breathing are possible. In mild to moderate cases, no additional tests are required. Symptoms are enough to manage enteroviral infection, but if symptoms are very severe, PCR testing is used for precise diagnosis. Enterovirus is particularly common in children. It is less common in adults, but still happens. Many adults have antibodies and immune response against enteroviral different subtypes. That's why adults are more protected. Enterovirus also spread in crowded settings like military barracks, summer camps, sport teams, and refugee shelters. In these places, there is prolonged contact and shared spaces, which increases spread via droplets and contaminated surfaces. Enterovirus replicates better in warm temperatures, so it is more common in summer. Enterovirus is also linked to water, such as rivers, lakes, pools, and the sea, because it can survive in the water for weeks. Now let's say about treatment. For sore throat, most effective treatment is Ibuprofen, 200 or 400 milligrams every 8 hours. It reduces inflammation, relieves pain, and eases swelling and discomfort. Paracetamol also effective, 500 milligrams every 6 hours. It is also effective but less strong than Ibuprofen. Topical anesthetic sprays and lozenges are also effective, like benzocaine, lidocaine, or benzidamine. They block sodium channel in nerve endings and stop pain signals. You can use 1 to 2 sprays or 1 lozenges every 2 to 3 hours. Warm saline gargles also works, especially with povidone iodine or chlorhexidine are best practice. Gargle 3 to 4 times a day with a warm solution. Half teaspoon of salt in 200 milliliters of water. Add anesthetic per instruction if needed, and don't swallow, just gargle. It soothes the mucus, reduces viral presence, and has antiseptic effect. Honey-based warm drinks with lemon or herbal teas are effective also. Mix 1 to 2 spoons of honey in water, but in warm water, but not hot tea, and 2 to 3 times a day. It improves swallowing, comforts the throat, and reduces cough and pain. For malaise and fatigue, adequate fluid intake is crucial. About 2 to 3 liters of water or oral rehydration solutions is effective. It balances nutrient, and focus on protein when you're eating, because amino acids are important for immune system cells, for repair and energy balance. Graded rest is crucial, but not complete bed rest. Alternate short rest periods with light activity like walking around the house for a few hours. This will help in your immune recovery while preventing deconditioning from inactivity. Try to sleep 7 to 9 hours a night because it supports immune regulation, cytokine balance, and tissue repair. For nasal congestion and runny nose, Intranasal corticosteroids like fluticasone or mometasone are considered best 1 to 2 sprays per nostril once daily. They have almost 70% effectiveness within 3 days. Best when started early for moderate to severe congestion. Avoid long-term use for short viral illnesses. Corticosteroids reduce mucosal inflammation and suppress local cytokine production. The second most effective method for nasal congestion is intranasal decongestants, like pseudoephedrine or oxymetazoline. They are alpha-adrenergic agonists. They constrict nasal blood vessels and reduce swelling and congestion. Oral pseudoephedrine is used 60 mg every 6 hours, or oxymetazoline nasal spray 1 to 2 spray per nostril twice daily. Oxymetazoline is effective in 80% of cases, but it should be used for short term, no more than 3 days. Isotonic or hypertonic nasal irrigation can also help in 50% of cases. It mechanically flushes mucous, allergens, and viral particles, hydrates the mucosa, and improves mucociliary clearance. Use 50 to 250 milliliters isotonic or hypotonic saline per nostril 1 to 2 times per day with a neti pot or squeeze bottle. Antihistamines, especially first generation like diphenhydramine or chlorpheniramine, are also effective in some cases. They block H1 histamine receptors, reduce nasal secretion, and cause mild drying via anticholinergic effect. Diphenhydramine typical dosage is 25 or 50 milligrams every 8 hours. They have a sedative effect and are best taken at time. Avoid in elderly due to anticholinergic effect, and avoid when driving or doing high focus activities. For cough, honey alone or in warm drinks is effective. It coats and soothes throat mucosa, has antimicrobial and anti-inflammatory effect, and reduce cough sensitivity. Take 1 to 2 spoons 2 to 3 times per day in warm but not hot water. For cough, dextromethorphan is possible, 10 mg every 4 hours, but only for short term. It suppresses the coughing reflex. It is best for dry, non-productive cough, but not during productive cough when there is mucus. Steam inhalation may help slightly, but it is not very important. Warm saline gargles also slightly help with cough. For headaches, ibuprofen and acetaminophen or paracetamol are considered best practice. For rash on the hands and feet, topical barrier creams like zinc oxide are effective. They protect skin and reduce the rash. Apply a thin layer 2 to 3 times per day. And for diarrhea, oral rehydration solution is best. They replace lost fluids, 200 to 400 milliliters after each loose stool. Also, you can use brat diet, which is banana, rice, applesauce, and toast, and probiotics like lactobacillus 1 or 2 times per day with food is considered best practice to recover natural flora in the gut.